Our consultant physician, Dr. John Okini, joins me via Skype from Ile-Ife in Osun State. It's good to have you join us, Doctor.
Good afternoon. Thank you.
Well, another surprise claim saying face masks are the most important, powerful public health tool, but the vaccine are not out yet. From your own experience here in Nigeria, does Dr. Redfield's claim hold water for you?
I will say no. Categorically, I will say no. One may be surprised because somebody in Nigeria is saying this as against the director of the CDC. But here are my points, for example. This is a new virus which is spread via droplets. It is highly infectious and highly contagious. And most people that have the disease are asymptomatic. In fact, children have it a lot, but they are called super. So if we say masks are the number one thing we have, we're hiding under one fact that if we all use masks, this disease will go. But one, we're all not using surgical grade masks. Surgical grade masks still have less than 5% chance that they can transmit the disease. That's why you see some masks are called KN or N95, N99, still having 1% chance. So if we're using even surgical grade masks, or like surgical mask or the KN95 or N95, people still have chances of getting droplet infections. Even with respirators, people still have chance of getting droplet infections. Now, those at home are not using surgical grade masks. This is a surgical mask, for example. There is still more than 10% chance. This is about 90% coverage. So there's still a 10% chance that things can pass through the small pores. The masks people use at home are even not up to this grade. Some use their bandana clothings, old clothings. Some people use ordinary face shields, which offer absolutely no protection. In children less than age of 5, they may also have COVID. And the CDC and WHO recommendations currently right now is that such children may not even use those masks, and if they're outdoor, they should not use it for long because of other respiratory issues. So to conclude that masks are the biggest things we have will be a political statement, because the disease has been rather politicized in the United States because of their elections. Vaccines, on the other hand, are very good, but we don't have them yet. There is a candidate vaccine that Russia has now made commercially available. There are about 150 vaccines being tested, various candidate vaccines that work in different ways by different companies being tested. If and when vaccines come on board, vaccines will offer every individual an acquired immunity that they will have, irrespective of whether they are using masks or not. What I will say is that vaccines and masks and every other procedures we do about personal hygiene, coughing to our nose, keeping social distancing, everything will work together complementary. I will not go as far as to say that masks are superior to vaccination. Unfortunately, we do not have vaccines available right now.
Well, let's take a look at the affordability of the mask, the face mask you just talked about, which you say are protective measures, not necessarily preventive measures, not necessarily curative. Look at the affordability that we should be using. What kind of mask should we be using specifically, considering people's buying power, purchasing power to get in a face mask that can prevent them from COVID-19?
I came across a very beautiful study that looked at different clothing materials as well as the standard surgical mask, this type, and then the other higher grades of N95 and the rest. Some of them come with valves, some are valveless. The best grade is the N95 that is commercially available. But persons who are COVID positive should not use the ones with masks, because they can still infect other people if it is the one that has valves or that has valves in them. Those are very good, but they're expensive. They come in the thousands right now, so most people cannot afford them. Even I, within the hospital setting, what I do is I use those masks when I'm seeing patients or when we're doing procedures. Otherwise, I use my street clothing mask and keep my social distance. When we talk about social distance, ideally should be 2 meters away from any other person. Those masks that are made from ordinary clothing are not effective in stopping viruses. Viruses are tiny little particles that we cannot see even with the microscopes that we have in biology labs. You need electron microscopes to see them. So they pass through those pores. What people are doing is they're trying to sieve water with mosquito net. The water will always pass through. These are droplet infections. So they really do not work effectively. The most effective thing is social distancing. But
Thing here in Lagos especially. But why, Doctor, if I'd ask you, why are we not seeing more Nigerian researchers come up with their own authoritative findings?
Nigerians are trying. The Redeemer University, for example, here in Osun State in Ede, without trying to sprout anybody's ego, they have a research center for in the microbiology unit. They are working on some vaccines. They have been helping in testing. So Nigerians are trying. Several other persons are doing all sorts of studies here and there. But if you check on the net, you'll see a lot of publications. Nigerians are trying. What I am saying vis-a-vis masks is that we should not rest on masks, that if we are wearing a mask, we are safe. On its own, that is not true. It can help to mitigate the problem, yes, but it is not an absolute. Vaccines will also help. And if I may chip in, not all vaccines that we take are 100% foolproof. The BCG vaccination that we give every Nigerian at birth against tuberculosis is only 10% effective against tuberculosis. But it does, even at that 10%, help to profile and confer each person with immunity that is lifelong against tuberculosis and some other diseases like leprosy. Because it's 10% immunogenic, we should not accept it. No. So I don't support what was said by the director of the CDC yesterday. I think it was just a political statement.
Consultant physician Dr. John Okene, thank you so much for your thoughts on the world now.
You're welcome. Thank you.